Hi, this is Jen Edelman, and this is my case study on Rose. Rose is a 33-year-old woman. She's overweight with a BMI of 29.1. She's 180 pounds and 5 feet 6 inches tall. Nearly a year ago, she was diagnosed with polycystic ovary syndrome and prediabetes. She and her husband decided to start trying for a child nearly 6 months ago, although Rose's monthly cycle is irregular and they haven't yet conceived. Rose does not exercise on a regular basis, nor is she very physically active. She has a sedentary full-time job and she frequently travels for work. Rose has only just started to think about her health and weight since her combined diagnoses, and she does not currently take any dietary supplements. Rose's physician had told her that losing weight would help manage her PCOS and prediabetes, helping her menstrual cycle return to normal. She has tried a couple of different diets and weight loss strategies since then, but with no lasting success. She recently started on a standard ketogenic diet on the advice and example of some of her friends and family members after hearing about the quick weight loss benefits of the keto diet. Rose has not consulted her physician or an obstetrician about her health markers since her appointment a year ago, or about the safety of starting her new keto diet program while trying to conceive. The macronutrient distribution of Rose's keto regimen is as follows. She eats high fat at 70 to 80% of daily calories, moderate protein at 20 to 25% of daily calories, and low carbohydrates at 5 to 10% of daily calories. Rose adheres to the keto diet as closely as possible on weekdays, but on weekends she gives herself more leeway to eat some of her favorite foods. She loves to try new steakhouse restaurants when she travels, so the keto diet is perfect for her lifestyle on the road. When she's on the diet, Rose eats meat, fish, or eggs at every meal, with 2 to 3 servings of vegetables and 1 fruit serving in a typical day. She consumes a lot of fats and oils, like butter, full-fat dairy, cheese, and coconut oil, and no alcohol during the week. She isn't fond of many fruits on the keto list, but she will have a banana 3 to 4 times per week for breakfast. Her total fiber intake during the week averages 10 to 15 grams per day. On the weekend, however, Rose indulges in 1 or 2 of her favorite meals, burgers and fries, bacon pizza, a brownie and ice cream, for example, and she usually consumes several alcoholic drinks over the course of the weekend. Rose did a 2-day food recall, which included 1 weekday and 1 weekend day. Let's take a look at what she ate. On the weekday, for breakfast, she had 4 eggs, 6 slices of bacon, a banana, and coffee. For lunch, she had white turkey chili. For dinner, she had creamy mushroom chicken with 2 cups of green salad. On the weekend day, for breakfast, she ate a plain bagel with cream cheese, 4 slices of bacon, and she had a cup of coffee. For lunch, she had a cheeseburger with fries and a Coke. Then for dinner, Rose ate broiled salmon, garlic mashed potatoes, a dinner roll, a slice of marble cheesecake for dessert, and she had 3 glasses of red wine with her meal. Following are my case study questions for Rose. From your perspective, what are the biggest red flags in Rose's health behaviors related to her current food intake, her plan for weight loss, and her potential pregnancy? Given the very low-carb keto diet, what vitamin inadequacies or deficiencies is Rose risking? What vitamin important for her potential future pregnancy, in particular, is she likely to be consuming too little of? What are some of the vitamins she is likely consuming inadequate amounts? Are there any further risks presented by vitamin interactions with any of these and the vitamins that may be inadequate? Would you recommend vitamin supplementation to Rose? If so, what supplements do you feel she could benefit from? And lastly, what dietary guidance would you give to Rose, taking all of the above into account? These are my references for the case study on Rose. Thanks for listening.